Androgen insensitivity syndrome, true is phenotype may be completely female. 10-year-old girl with primary amenorrhea, absent breast, malformed uterus, the most likely diagnosis is Turner syndrome. All of the following are true about imperforate hymen except it is diagnosed in the neonate is wrong. So what is true about imperforate hymen? It may cause hematocolpos. It is treated with a cruciate incision. It may cause urinary retention. Mayer-Rokitansky-Kuster-Hauser syndrome consists of uterus absent, fallopian tubes, ovaries present. Clinical features of Turner syndrome is all except cryptorchidism. So what are the clinical features of Turner syndrome? Short stature, gonadal maldevelopment, bicuspid aortic wall, and lymphedema. Match the list of syndrome with the conditions. So androgen, female phenotype 46XY with absent Mullerian system, and Mayer-Rokitansky-Kuster-Hauser syndrome, Mullerian agenesis, insensitivity with 46XX syndrome, Swear syndrome, female phenotype with 46XY, gonadal dysgenesis with patent Mullerian system. Kallmann syndrome is hypogonadotrophic hypogonadism with anosmia. All of the following are true about MRKH, Mayer-Rokitansky-Kuster-Hauser syndrome, except absent ovary. So what is true is absent uterus, absent cervix, absent vagina, but present ovary. A 20 years female present with primary amenorrhea, absent breast, hypoplastic uterus, most probable diagnosis is Turner syndrome. Causes of primary amenorrhea are all except Sheehan syndrome. So Sheehan syndrome is not a cause of primary amenorrhea. Rokitansky syndrome, Kallmann syndrome, and Turner syndrome are causes of primary amenorrhea. Primary amenorrhea with absent uterus, normal breast, and scant pubic hair is seen in androgen insensitivity syndrome. Primary amenorrhea with normal ovaries, normal external genitalia, and normal breast is seen in Mayer-Rokitansky-Kuster-Hauser syndrome. A 19-year-old female has short stature, widespread nipples, and primary amenorrhea. She is most likely has karyotype of 45XO. Commonest genetic defect causing gonadal failure with primary amenorrhea is Turner syndrome. Which one of the following is not a feature of Turner syndrome? Mental retardation is not a feature of Turner syndrome. Webbed neck, horseshoe kidney, and coarctation of aorta are features of Turner syndrome. True about MRKH syndrome is absent uterus, absent vagina, XX phenotype, ovaries are present. True about Klinefelter syndrome is XXY, male hypogonadism, and TFSH, increased FSH. A 13-year-old obese unmarried girl presents with the history of amenorrhea and and cyclic abdominal pain. On examination, the secondary sex characters are found to be well developed. What should be the next step? Next is vulva. Vulval carcinoma metastasizes to which lymph group? Superficial inguinal nodes. True about carcinoma vulva, spreads to superficial inguinal nodes, spreads to iliac nodes, seen after menopause, viral predisposition, and radiotherapy is given. Vagina, Nabatean follicle occurs in erosion of cervix. pH of the vagina is lowest during pregnancy. Most common form of vaginitis is Trichomonas vaginitis. Mycotic vulvovaginitis is due to Candida. Vulval candidiasis is associated with diabetes mellitus. Commonest genital infection in female is trichomoniasis. Involvement of pelvis in a case of vaginal carcinoma of stage. The maturation index on vaginal cytology is a diagnostic method for evaluating the endocrine status of the patient. Protective bacterium in normal vagina is lactobacillus. True about bacterial vaginosis is grey discharge, clue cells found, fishy odor discharge, and caused by Gardnerella vaginalis. True about Trichomonas vaginalis, flagellated parasite, pruritus, and sexually transmitted. Gardnerella vaginalis infection is diagnosed by all except pH less than 4.5 is not diagnostic. Fishy odor, clue cells, and positive whiff test are the diagnostic. A 40 years old woman presented to the gynecologist with complaints of profuse vaginal discharge. There was no discharge from the cervix. On the speculum examination, the diagnosis of bacterial vaginosis was made based upon all of the following findings on microscopy except abundance of polymorph. So what were the criteria? Abundance of gram variable coccobacilli, absence of lactobacilli, and presence of clue cells. Consider the following characteristic of vaginal discharge. Which of the above characteristics are present in bacterial vaginosis? So clue cells and Whiff test positive are present in bacterial vaginosis. With reference to vagina, which one of the following statement is not correct? It has mucus secreting gland is incorrect. It is supplied by uterine artery. It is lined by stratified squamous epithelium, and its posterior wall is covered by peritoneum. Senile vaginitis is due to estrogen deficiency. A woman presents with a fluctuant non-tender swelling at the introitus. The best treatment is marsupialization. True statement regarding sarcoma botryoids is involvement of vagina. Grape-like growth is seen and malignant. All are risk factor for vaginal candidiasis except hypertension. So risk factor for vaginal candidiasis are diabetes mellitus, HIV, and pregnancy. Vaginal adenosis precede squamous cell carcinoma of vagina. Sexually transmitted diseases in the female, herpes genitalis causes coilocytosis in smear, carcinoma cervix. In chlamydial cervicitis, drug of choice is tetracycline. Asymptomatic gonorrhea in female is due to infection of endocervix. One of the following in adult female genital tract is not affected by gonococcal infection, vagina. An infertile woman underwent hysterosalpingogram. It showed bilateral beaded tubes with enlargement at ampulla. The organism responsible is tuberculosis. Gonococci has affinity for columnar epithelium. True about bacterial vaginosis. Typical whitish grey discharge. Metronidazole is drug of choice. Clue cells are seen and vagina pH usually between 4 to 6. True about vaginal candidiasis associated with intense pruritus. Typical cottage cheese discharge occurs. Bacterial vaginosis is characterized by clue cells and wet mount. Cervicitis is caused by Staphylococcus, Chlamydia, Trichomonas, and Neisseria gonorrhoeae. Acute pH is treated by IV antibiotics, broad spectrum drainage of TOM, and laparoscopic exploration. Acute PID. Bacterial vaginosis is characterized by clue cell amide test is positive and sexually transmitted. Non-gonococcal urethritis is caused by chlamydia. Treatment of choice in Gardnerella vaginitis in pregnancy is metronidazole. Gardnerella infection not seen in pH less than 4.5. Gardnerella infection is seen in if amine test positive, discharge per vaginum, and pruritus. A 30-year-old woman with a bad obstetric history presents with fever. The blood culture from the patient grows gram-positive small to medium coccobacilli that are pleomorphic, occurring in short chains, direct wet mount. Listeria monocytogenes. The most sensitive method for detecting cervical chlamydia trachomatis infection is direct fluorescent antibody test. Whiff test is used to detect bacterial vaginosis. Which one of the following is not a characteristic feature of bacterial vaginosis? Thick white discharge. So what is the characteristic feature? Presence of clue cells, vaginal pH more than 4.5, and Vichy order. Salpingitis or endosalpingitis is best confirmed by hysteroscopy plus laparoscopy. Which is most commonly implicated in genital or vulval wart? HPV-6. Clue cells are seen in bacterial vaginosis. Trichomonas. True is foul smelling vaginal discharge and strawberry cervix. Which of the following can be diagnosed on vaginal wet mount smear? Trichomonas vaginalis, Candida albicans, and Neisseria gonorrhoeae. Clue cells are found in bacterial vaginosis. Creamy fishy odor is characteristically seen in Gardnerella. A lady presented with creamy white vaginal discharge with fishy odor. Drug of choice is metronidazole. Genital warts in pregnancy treatment is cryotherapy. HPV vaccine is both bivalent and quadrivalent. Clue cells seen in bacterial vaginosis. With regard to trichomonal vaginitis, the following statements are true except that it is treated with doxycycline. That is wrong. So what is true is discharge is greenish and frothy. It is described as strawberry vagina. Culture of discharge is not necessary for diagnosis. Clue cells is seen in bacterial vaginosis. Clue cells are seen in bacterial vaginosis. Which of the following statement about chlamydia trachomatis is true? Use of oral contraceptive pill is associated with increased risk of asymptomatic chlamydial infection. The diagnostic criteria for bacterial vaginosis include the following except vaginal pH less than 4.5. So, what are the diagnostic criteria? Homogeneous vaginal discharge, presence of clue cells, and positive whiff test. A woman who is in the reproductively active age group presents with a history of greenish and frothy vaginal discharge on per speculum examination. She has multiple punctuate strawberry-like spots. What is the likely diagnosis? Trichomoniasis. Clue cells are seen in bacterial vaginosis. Tuberculosis of the genital tract. The commonest complication of pregnancy after complete treatment of genital tuberculosis is ectopic pregnancy. TB endometritis is caused by retrograde spread. The most common cause of tubal block in India is tuberculosis. Which is the most common site of involvement in genital tuberculosis? Fallopian tube. Most common site of tuberculosis of genital tract is fallopian tube. Urinary system. Stress incontinence is a common symptom of prolapsed uterus. Marshall-Marchetti grant surgery is done for stress incontinence. Boney's test is used to demonstrate stress incontinence. Incontinence in elderly female is due to the most commonly true stress incontinence. Urethral caruncle is best treated by chemical cauterization. Kelly's plication operation done in stress incontinence. Urinary fistulas. Commonest cause of rectovaginal fistula is improper repair of perineal tear. Uterovaginal fistula formation is common at infundibulopelvic ligament. Manifestation of uterovaginal fistula is continuous incontinence. 1 week after an extended hysterectomy, the patient leaks urine per vaginum. In spite of the leakage, she has to pass urine from time to time. The most likely cause is ureterovaginal fistula. In a case of incontinence of urine, dye filled into the urinary bladder does not stain the pad and the vagina, yet the pad is soaked with clear urine. The most likely diagnosis is ureterovaginal fistula. Sonia, who underwent vaginal hysterectomy and lymph node dissection, presents with incontinence of urine and passing some amount of urine which is under her control. Most likely diagnosis is ureterovaginal fistula. Vesicovaginal fistula in India is most commonly due to prolonged labor. A primipara who had a prolonged labor and difficult vaginal delivery 3 months ago presents with complaints of incontinence of loose stools and flatus from the day of delivery. The most likely diagnosis is complete perineal tear. Bovari's operation is bladder flap. Chasseur-Moir technique is used in vesicovaginal fistula. In women with ureterovaginal fistula, the following statements are false except that should be repaired as soon as diagnosed on IVP. Patients of rectovaginal fistula should be initially treated with colostomy. All are treatment for stress urinary incontinence except all. So all are treatment for SUI except.